Hello everyone, I'm Dr. Swagatesh Bastia, Director and Co-founder at Alleviate Pain Management in Bangalore. Today I'm going to discuss the history of prolotherapy. Now this wonderful treatment, also referred to as proliferative therapy, dates back to the time of the ancient Egyptians, where they used to treat lame animals with branded rods. Later on, the first use of prolotherapy in humans is noted at around 400 BC by Hippocrates, where he treated a dislocated shoulder with a hot rod using it in the axilla. Following that, in the early 1900s, there are reports of repair of hernia with a proliferating solution. In 1937, Dr. Gedney came up with a beautiful paper about prolotherapy for the treatment of an injured or a lax thumb. Finally, in the 1940s, a lot of work was initiated by Dr. George Hackett, who was a trauma surgeon initially, but later devoted his life completely towards treating patients with prolotherapy. Now, Dr. George Hackett, who is also known as probably the founder of modern prolotherapy, was a firm believer. He came to believe from his patients, by treating his patients, that lot of disability and musculoskeletal pain is because of tendon and ligament relaxation. Dr. Hackett did a lot of work in treating patients with low back pain, and he treated thousands of patients with low back pain with prolotherapy with an amazing 90% success rate. He believed that injecting a proliferating substance such as dextrose into the ligament and bone interface helps in creating thick and strong fibrous tissue covering over that, which leads to increased inherent strength as well as decreases the ligament laxity. Now, Dr. Hackett's work was followed by Dr. Gustav Hemwall, who was also his student and a physician. Dr. Hemwall further expanded the scope of prolotherapy into other parts such as treating ankle pain, thumb pain, elbows and shoulders and so on. And he also met with great success in addressing these treatments with prolotherapy. Now, initially prolotherapy, the main irritant used in prolotherapy was dextrose, and a mixture of dextrose and local has been used very often. But in recent times, new agents like sarapin and sodium morphate have also found popularity. Now, we at Alleviate are firm and big believers of prolotherapy, and as in the West, people have been benefiting with the wonders of prolotherapy for the past century. It is our humble endeavor to do our bit in treating patients with prolotherapy and continue the legacy of these two great men who I spoke about.